Preoperative situation. A 24-year-old patient with a fractured central incisor in the right lower jaw. First, the teeth are cleaned with a polishing paste. The dentin shade is determined in the region of the cervical to the second third of the incisor to be restored. In addition, the enamel shade is determined on the basis of the upper, for example, incisal third. After a rubber dam has been applied, the vestibular preparation margin is marked with a wave-like line. A bevel is prepared, using light pressure and low speed. Water spray is not used. A conventional bevel is prepared along the lingual aspect of the incisor. It is advisable to use oscillating instruments for interproximal preparation. After the preparation has been completed, translucent matrices are positioned at the proximal sides and wedged. A self-etching primer is applied to the dentin and enamel and allowed to react for 30 seconds. After that, the primer is thoroughly dispersed. Next, the bonding agent is applied, briefly dispersed and light cured. Subsequently, the index finger is placed behind the tooth, serving as a matrix for building up the lingual wall. The lingual wall is reconstructed in an increment that stops 2 millimeters below the incisal edge, using the enamel material selected. It is important that the lingual wall be suitably thin to provide enough space for the subsequent dentin materials. After the first increment has been applied, the composite is briefly light cured and the position of the increment is checked. Next, the increment is completely polymerized. Subsequently, the index finger is again placed behind the incisor. The lingual wall is now built up to the height of the incisal edge, using clear enamel material. Then, the second increment is polymerized. Next, the dentin material is applied, and the mamelons are shaped. If several layers are used to fabricate the dentin core, each layer should be light cured individually. The dentin core is polymerized. Next, another thin increment of the enamel material selected is applied to the vestibular aspect of the tooth. Then this layer is polymerized. The vertical ridges are built up with clear enamel material to increase the stereoscopic effect of the restoration. The layers are polymerized individually. The transitional areas are easily smoothed over with a brush. Then the material is polymerized again. Vertical, wedge-shaped increments are applied to the central area of the incisor using clear enamel material. To complete the layering procedure, a small portion of the enamel material selected is applied to the facial area and adapted. After the wedges and matrices have been removed, the restoration is pre-finished, using flexible discs and fine diamonds. Next, the rubber dam is removed, and the final shaping procedures are carried out. In the process, the occlusion and articulation are checked and adjusted. To complete the procedure, the restoration is polished to a high gloss using abrasive brushes. Completed restoration.